This feature is brought to you by JPHMP Direct, the companion site of the Journal of Public Health Management and Practice. Today we are joined by Dr. Lloyd Novick, founding editor of the Journal of Public Health Management and Practice. Thank you, Dr. Novick, for speaking with me today. First question I have is, can you briefly describe your medical training and background in public health?
Yes, I went to New York University School of Medicine, and following that, I interned at Bellevue Hospital in New York City, and then I spent 2 years in the public health service. I wasn't doing public health. I was a primary care physician in the Coast Guard, and when I finished with that, I did a preventive medicine residency at the New York City Department of Health. And during that residency, I was the district health officer for Central Harlem. And a year of that residency I spent at Yale University School of Public Health.
So 2019 marks the 25th anniversary of JPHMP. Can you reflect on some of the public health challenges that were present back in 1995 when you started the journal, and what role you felt the publication of this type could serve to meet some of those challenges?
Well, many of the challenges in 1995 were similar to ones we have today. First issue was on health reform, universal health insurance, but that was the Clinton proposal. And there's an interesting story there that I had an entire issue with articles about the Clinton proposal, but then shortly before the issue published, while the issue was in proofs, the Clinton effort failed, and we had to edit the articles in the proofs to show that the proposal had failed. Many of the issues then were similar to what we had today. We had issues on preparedness, issues on workforce. The purpose of the journal was to give a voice to public health practitioners, encouraging public health practitioners to actually contribute to the literature, because we thought their viewpoint was very valuable, and we thought also by them contributing to the scientific literature, they would not only make the scientific literature more rich, but that they would improve their job performance as well.
And what have been some of the journal's crowning achievements?
The journal has really captured the most pressing issues in public health practice, and we've followed them through the period of 25 years. For example, we've had 4 or 5 issues on public health accreditation. We've had probably 6 issues on public health preparedness. We've had a number of issues on public health workforce, and including the 2 recent issues, we've had the 2 Workforce Interest and Needs survey just published in the last year. We've had issues on quality improvement. So we have really captured progress in public health practice, and I believe we have contributed to that progress by making these advances known to the practice community. And by the practice community, I mean public health workers, both at the local level, the state level, and the federal level, specifically the Centers for Disease Control. And over the years, there have been a number of people in academia who've been interested in public health practice, and they've become major contributors to the journal. So an example of that are the articles and the special issue we have done on academic health departments.
Yeah, you mentioned the Public Health Workforce Interest and Needs Survey, which is put together by the Beaumont Foundation. Can you speak a little bit about to the issue of the public health workforce and undergoing this critical demographic shift that's taking place, and how that may compromise public health? And what role, if any, do you feel the journal plays in helping to assure that the future workforce will be able to meet some of these challenges that may lie ahead?
Well, the issues that we have published on workforce, including the most recent supplement issue, wins in March of this year, which described data that was collected during the 2017 Workforce Interest and Needs Survey, sort of outlines the aging of the workforce and the incentives people have to stay in public health. It also looks at the various demographic characteristics of the workforce and also the role of gender in the workforce. And these factors are very important to the further strengthening of the workforce. These issues also explore what training is needed for the future of the public health workforce. And the public health workforce is the key element of public health infrastructure.
Can you talk a little bit about what makes the journal relevant resource for public health practitioners, researchers, policymakers in the next 5, 10, 15 years?
I think the same thing that has been present for the last 25 years. We set out with the idea of bringing public health advances in policy and practice, both to a practitioner audience and to an academic audience. And in the next 5 years, we will be doing the same. The constellation of issues has both remained the same and has also changed. We're trying to get more articles on, for example, opioid use, substance abuse. We'd like to get more articles on violence. We've done a supplement recently with CDC on violence, but we'd like to get more articles on gun violence. So where the issues are in public health, we intend to capture them. We want to follow the progress of accreditation, which has been a major groundbreaking movement in public health, one that we have documented from its early inception to the present, and we will continue to do that in the future.
Is there anything else you'd like to add? Would you like to maybe give us a preview of some of the upcoming issues that are in the works?
Well, we have a very exciting issue that's coming out in July, titled Investment in Population Health. We're working a lot with the Trust for America's Health, and the issue is led off by a commentary by Adam Lustig of the Trust for America's Health. And it talks about how important cross-sector collaborations, like the design of communities, are, and the contributions of policy in other sectors are to public health. It focuses on social determinants. Also in that issue, we have a large series of articles on hospitals' community benefit expenditures and how these benefit expenditures improve public health and relate to public health outcomes. We also have some very interesting articles in that issue on substance abuse. We have an article from Erica Martin, one of our newer editorial board members, on an opioid dashboard, in which she talks about how data can be used by various communities to show the extent of the problem. She gives 10 lessons or recommendations for using that data. And also we have a case study in the journal. Case study is one of our newer formats. These are narratives or stories in public health. This story is about a public health state health director, Danny Staley, and his role in instituting a safe syringe exchange program in North Carolina. A fascinating story. We have published a number of these case stories in the journal and will continue to do so in the future. We have 2 more in the hopper right now. And again, this is an area we want to emphasize because it's so key for training not only of state health directors, but training of public health workers.
It sounds like a really exciting and quite large issue that'll be coming out in July. So that's a lot to look forward to.
And those are the kind of issues that we will have in the coming 5 years. So stay tuned. Also, I'd like to compliment the journal staff for its work on JPHMP Direct, which is an online blog that's connected to the journal that really furthers our efforts and our goals of showing what's going on in public health practice, what are the latest advances.
Well, thank you for saying that, and thank you for taking time to talk with me today, Dr. Novick. We really appreciate hearing from you and sharing information about the journal. So thank you very much.
Right.
This feature was brought to you by JPHMP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about Dr. Novick and the 25th anniversary of the Journal of Public Health Management and Practice, visit us online at www.jphmpdirect.com.